Dr. Stephen McDonald. He's an emergency medicine physician with New York Presbyterian. And Dr. McDonald, great to have you back on the program. This is clearly a very historic day. What can you tell us I don't know what extent you're able to talk about this, but what can you tell us about how your hospital is handling the distribution efforts? And have you also had your own shot yet?
Absolutely. So, the details around distribution are still relatively opaque, but we have been told that we're going to be getting the vaccine at some point this week, and that it will be distributed through the emergency room. So I, for one, am extremely excited about this. This is the beginning of the end, I think, for the coronavirus.
And so you will be getting your shot presumably this week or next week. Is that what we're hearing?
That's the hope. It could be as early as tomorrow. So we'll see. But unfortunately, I don't have solid details on the exact timing of delivery.
Dr. McDonald, it was encouraging to hear you just say a couple moments ago that this is the beginning of the end. And it's great news when it comes to the vaccine. But what are you seeing right now just in terms of the virus spread, and what you're seeing in your hospital just about your capacity limits and how you guys stand at this point?
Absolutely. So numbers in New York State are extremely concerning. What I'm seeing on the ground, there's definitely more coronavirus, more sicker patients than we had throughout the summer and early fall. That said, we're nowhere near where we were in New York City in end of March and early April, which is somewhat hopeful.
Regarding this vaccine, so you get the first shot. How much protection does that give a person before they get the booster? Do you need both shots to have the 95% efficacy, or does one shot protect you until you get to that second?
So the studies that refer to the 95% efficacy rate, those only refer to patients who have received both shots. And so with the Pfizer vaccine, that's at 0 days and 21 days. With Moderna, it's at 28 days. That said, it is thought that the first shot does confer some protection, but that does not nearly approach the 95% efficacy that we're speaking about and that you're seeing in the press.
So, Dr. McDonald, it protects you once you do get the vaccine, but we don't know just about what it does in terms of transmission. So what does that mean for people who do get the vaccine once it's rolled out to the general population? Should they still be wearing masks? Should they still be social distancing? What type of measures should we be taking just so that we are cautious and make sure that the virus doesn't continue to spread?
It's a great question. So, yes, we should absolutely all continue wearing masks even after we get the vaccine. And my hospital, for one, has already made that a policy that we're going to enact. And that should be a policy throughout the United States. People who have been vaccinated can still potentially spread the virus, even if they themselves do not get sick or do not need necessarily a hospitalization.
Doctor, I want to take a step back, and I think all of us were watching television this morning when the nurse on Long Island got that first shot. What went through your head when you watched that, if you got a chance to see it?
I did get a chance to see it. If I'm being honest, I'm a little jealous. I really can't wait to get my shot. I'm just so excited that the scientific community has come together and gone from taking this previously unknown virus and discovering a vaccine for it, and done it in a safe way and in a way that I, as a physician, can feel really excited about and honestly can't wait for. So yes, it's really exciting, and I'm incredibly hopeful about the months to come.
Has this helped raise the spirits just amongst you and your colleagues, just the fact that it seems like the end may be in sight now, or there's light, I guess is a better way to say it, there's light at the end of the tunnel?
Absolutely. I think spirits are raised. That said, there's still a bit of caution as we watch the rates rise across the United States. We watch the hospitalizations rise. And we know that the vaccine is going to take some time to be delivered to the most vulnerable patients. So, I'm cautiously excited. I'm ready. There's definitely a light at the end of the tunnel, as you said. But at the same time, there's going to be some difficult weeks ahead before we have this fully unrolled.
And you're referring perhaps to the fact that Mayor de Blasio here in New York City has said we may have a full lockdown. I'm not sure the timing, but it sounds like it's coming soon. Any sense of how long we would need to lock down this time around, since we are not going through the same kind of spikes that we had back in March?
Sure. So once you take a public health action, we see then the cases fall around 2 weeks after that. And then hospitalizations and death rates fall around a couple weeks after that. So the hope would be that, if we take an action in the next week or 2 weeks, we would know in the next month or so whether or not that's been effective and if it would have to continue or not.
Dr. Stephen McDonald, always great to have you on the program. We know you're extremely busy, so we really appreciate you taking the time. Emergency medicine physician with New York Presbyterian. We hope to talk to you again soon.
Always a pleasure. Thank you.